Patients want to understand their prognosis, want to understand the toxicities of treatment, and they also want to understand what their life looks like after treatment. So in general, soft tissue sarcomas are managed surgically, meaning that the whole tumor is excised. And surgery is meant to remove the mass that the surgeon could see, both with their eyes and on imaging. Radiation is intended to eradicate microscopic disease that may be left behind, that the surgeon can't see with his or her eye, or that can't be picked up on a scan. Radiation is a daily treatment given once a day, 5 days a week, for approximately 5 to 6 weeks. In general, patients can work, at least during the initial portion of those treatments. However, depending on how their toxicity progresses, they may not be able to work on a daily basis towards the end of treatment. Typically, patients see their radiation oncologist once a week during treatment, and they should always explain all the toxicities that they're developing. And one of the benefits of seeing patients on a weekly basis is that we could really manage those toxicities as they develop so that they don't become too severe. If we're treating a sarcoma in the head and neck, there could be toxicities related to swallowing, to taste, and to saliva. If we're treating a joint, obviously the mobility and flexibility of that joint is a concern. If we're treating an extremity, swelling in that extremity termed lymphedema, we watch out for. And those are all potential toxicities depending on the site of treatment. I think the best thing people could do undergoing treatment is to just focus on the task at hand, to come in for radiation every day, to follow with their physicians as prescribed, and to undergo all the imaging that's ordered for them, and of course be vigilant about their bodies. Focus on their pain control, focus on their function, focus on their food, focus on their calories, focus on their fluid, and over time they will naturally return to their normal life, but it's most important to get the treatment that you are prescribed.